Hi everyone, I'm Xueqin Huang. Welcome back to our online section. The topic for today is Vital Sign Part 2. Last time we have discussed the components and normal ranges of vital signs. This time we are going to talk about how to take vital signs. After this section, you will be able to describe the appropriate equipment for vital sign measurements and verbalize the steps used in assessing body temperature, pulse, respiration, and blood pressure. In the clinical setting, the purpose of taking vital sign is to obtain baseline data for subsequent evaluation, to monitor and assess change in the patient's health status. Before taking vital signs, we should prepare all the required equipment, different types of thermometer as needed. We will focus on the axillary route in this section. A stethoscope, a sphygmomanometer with appropriate cuff size, a watch with a second hand, tissue or gauze as needed, a record form and pen, a tray to hold all supplies. Prior to performing the procedure, we should confirm that all equipment is functioning normally. There are several types of thermometer in clinical setting. For example, electronic, chemical, etc. Although traditionally, body temperatures were measured using mercury in class thermometers, nowadays they have been replaced by the others because of the hazard of the mercury. Blood pressure is measured with the blood pressure cuff, a sphygmomanometer, and a stethoscope. The cuff consists of a bladder that can be inflated with air. It has two tubes attached to it. One tube connects to a pump that inflates the bladder. You can see a small valve on the side of this pump that traps and releases the air in the bladder. Be sure that the bladder of a blood pressure cuff is 40% of the arm circumference or 20% wider than the diameter of the midpoint of the limb. Now let's talk about how to take axillary temperature. First, perform hand hygiene and follow standard precaution. You should introduce yourself and verify the patient's identity according to institutional protocol. Explain to the patient what you are going to do, why it is necessary, and how he or she can participate. Provide privacy for the patient. Pack the axilla dry if very moist, because moist in the axilla will cause inaccurate reading. Place the tip of the thermometer in the center of the axilla. Then, keep the arm flexed across the chest, close to the side of the body. Hold the thermometer in place for appropriate time according to manufacturer's instruction. After that, remove the thermometer, read the fingers and record it. sanitize with alcohol swab and put it back safely. If the temperature is obviously too high, too low, or inconsistent with the patient's condition, recheck it and inform the doctor if necessary. A pulse is commonly assessed by palpation. Now let's see how to measure a radial pulse. Perform hand hygiene and appropriate infection prevention procedures. Place the tips of your index, middle, and fourth fingers lightly and squarely over the patient's radial artery. Feel and count the pulse. Please note that you cannot use the thumb. Do you know why? That's right. You can feel a pulse from the thumb by yourself that could be mistaken for the patient's pulse. If the pulse is regular, count for 30 seconds and multiply by 2. If the pulse is irregular, you should count for at least a full minute to be more accurate. Note the pulse rhythm and volume while counting. If the rhythm is regular, the intervals between the beats are all the same. Please note that the normal pulse rate varies with ages. The respiratory rate is normally taken immediately after the pulse rate. It should be taken without patient's knowledge. Before the procedure, make the patient comfortable and ensure that you can see the chest and abdominal movement clearly. While we are counting, keep your fingers on the pulse, pretending you are taking the pulse. That's because if a patient knows you are counting respirations, he or she may not breathe naturally. Count for 13 seconds if the respirations are regular. If not, count for 60 seconds. We should document the respiratory rate, depth, rhythm, and characteristics on the appropriate record. Now let's go through measuring blood pressure. Before that, confirm the patient has already rested for at least 15 minutes. Make sure that he or she has not smoked or taken caffeine within the past 30 minutes because both could cause a temporary increase in blood pressure. Position in patients appropriately. The elbow should be slightly flexed with the palm facing up and supported at heart level. Wrap the cuff evenly around the upper arm. Locate brachial artery. For an adult, place the lower border of the cuff approximately 2.5 centimeters above the antecubital space. Position the stethoscope appropriately. Turn earpiece slightly forward so you can hear the sounds more clearly. Place the stethoscope diaphragm over the patient's brachial artery. After closing the valve on the bump, inflate the cuff to 30 mmHg above the point where the brachial pulse disappears. Then release the valve slowly so that the pressure decreases at a rate of 4 mmHg per second. During the procedure, note the scale on the dial when first cough sound is heard. This is the systolic blood pressure. You will hear regular cough sounds as you continue to release air. when the sound disappears. We have the diastolic blood pressure. Then deflate the cuff rapidly and completely. Wait 1 to 2 minutes before making further measurements. Don't forget to perform hand hygiene and clean equipment before you go to the next patient. In this section, we have learned that obtaining and recording patients' vital signs is one of the most important and commonly performed tasks for nurses. Vital signs may be altered by many factors. Nurses must recognize and, if possible, rectify factors that may produce inaccurate results. Accuracy in taking vital signs is imperative because treatment plans are developed according to the measurement of the vital signs. That's all for today. These are my references. Thank you. Bye.